the focus of this whole season and probably the rest of my career. And that's mental health. And again, I'm an internal medicine doctor by training, but my purpose in life is to help as many people as I can in whatever way I can. And I am just watching the mental health of our society crumble before my eyes. When all of this started and we didn't know anything, and we're not here to talk about what happened, but we cannot ignore this transformational experience the entire world went through. Yeah. And the outcome of that transformation is exactly what I predicted. And if you guys listen back to Sapien podcasts before, which we released during that time and got removed, if you can find them, I think they're on YouTube. But my biggest message about everything was we're forgetting about the mental health of people. Yeah. Because when you compromise the mental health of young children, you put them down an entire life of struggling and dealing with that. It's traumatic, right? We acknowledge childhood trauma, physical abuse, sexual abuse, being shunned. We acknowledge all of these weird behaviors that parents and adults can do to children that destroy their ability to be a successful adult. And we work hard to discuss it and work on it. And yet we make policy that doesn't consider that at all. What are you doing with these kiddos? Are you guiding them? Do you provide them books? Are you look, you're a very inspirational guy. So are you coaching them? I'm just curious how you, again, approach the young kids, because I struggle with it in my, as a doctor. It's very hard to know what to do with a 16-year-old that's afraid to go outside. And then you educate them on everything. And they're like, no, I get it, but I'm afraid to go outside. Yeah. And you're like, well, let me get you into therapy. Well, insurance doesn't cover the therapy. Oh, well, what? And then, hey, you want to put them in an antidepressant that's going to numb them and sedate them and make them, suppress their sexual function and make them gain weight. It's just like a nasty mess. Yeah. I feel compromised in their care. Where's your head on this? Because you're dealing with them every day.
Yeah. So, like I walk down the halls of my school and I'm like Leonardo DiCaprio. I'm very popular at my school. Kids are coming up to me all the time when I talk to me about what's going on in their lives. And then I kind of formalized it too. And I have a calendar that I put out on my Calendly in the beginning of the year. And I have lunch with a different student every day. So it's cool. So it's just the two of us and we sit down and we just talk about what's going on in their lives. So I think that seeing that I actually care, it actually helps me too, to connect with them, connect the material to them and stuff. But I walk them through on an individual basis. But the stories are terrible. And I used to teach in East LA in the hood. And now I'm at this kind of hoity-toity private school on the west side of LA. But the problems there are problems here. But yeah, the over-medication issue is a big one for me. Yeah.
I don't want to interrupt you, but the problems that more poor people and rich people suffer the same exact problems. No one is immune to what happened over the last 5 years. I just want people to understand that, because I have both populations and it's the same. Yeah. The money doesn't guard you. The poverty doesn't make it worse. It's all a huge mess.
Yeah, it was actually great. I was friends with a woman. She's an influencer, a teacher on Instagram too, named Brittany Caldwell. And she had taught an all black school in Atlanta. And I'm at this white religious school in Jewish school in the West Side. And we actually blended our classrooms over Zoom. It was super cool. And they were talking they had so much in common. So yeah, absolutely what you're saying. But the over medication is, I think that what happens is the same thing about I trusted my doctor. Doctor was like, hey, give the vaccine. No, it wasn't you at the time, but give the vaccine for this, give the vaccine to your kids, your baby, do this, do this, do this, do this, do this. And I trusted so much, of that. And I think that what happened with mental health is the same thing. Parents are like, oh, my child's suffering. What do I do? What do I do? I don't know where to go from here. And a lot of people, they're not like us. They're not listening to medical podcasts and reading all these books and stuff like that. They're just going to trust the doctor. So I had a lunch meeting with a girl last year, and she was 17. And she had been on an antidepressant, an anti-anxiety, and an anti-ADHD medication since she was 12, straight through. So her whole brain, all it knows is these exogenous chemicals going into her body. And it's that's not uncommon. It's very, very, very common. And I just put these ideas in their head. Do you ever want to get off this? How would you? Not telling you that you should. I don't push ideas, even on my social media. You say, I don't push ideas, but I do push you to think. So I challenge it. And I do a lot of that. And then I encourage them to do a lot of the stuff that you talk about, like sapient stuff, like going outside, what's in your diet, how do you eat, getting lots of sleep, like that kind of stuff. I promote to my students all the time. It's really cool because some of them do it. They start doing like ice baths and cold showers, and they come in, they're like, I felt great. I did a cold shower this morning. They're like high five, and I'm like, yeah, let's go. And that kind of stuff is really, really neat. So I see the students that do it, then they do have like some level of getting better, and then they promote it. And so I have this, like, I have a whole bunch of weirdos around my classroom. These kids are doing it.